Hi, Ilyse. Welcome back to Nutrition Science Bites.
Hello, Claire. How are you today?
Yeah, really great. So, you have actually told me you've got the topic for us this week.
Yes, so on our emails and on our socials, we've received a question from a listener and they want to know about migraines and if nutrition has an impact on migraines. So, can you help us out with this topic, please?
Yeah, I think that's really great. And I want to give a shout out to Headache Australia, who've got lots of great resources for people who get both headache or migraine. So, I think the first thing to say up front is that migraine is a really specific type of headache. And then and we will talk about diet and migraine specifically. But first of all, I think it's worth talking about headache generally. And we have written about this before and got a very brief fact sheet on No Money, No Time for headaches and migraine. So we'll also update that to reflect the newest information and put a link in the show notes. So first of all, I think it's worth saying that headaches are actually really, really common. And each year, 50% of Australians will get a headache. So basically everybody gets a headache, but we get them from a different type. The most common type of headache is tension type of headache. Things gone wrong. Remember the last time I had a beauty whopping headache was driving back from Sydney and there was a car accident and we actually just sat in the car for 2 hours, couldn't go forward, couldn't go backward, didn't have any water. So that was what I would consider a tension type headache. But the other common types of headaches are migraine and then another category of headache called a cluster headache. And I really feel sorry for people who get that, where they get multiple intense headaches in a very short period of time. And that can happen to them, once a year or multiple times a year. But again, I'm going to tell people if you want to know anything in detail about the type and the medical aspects of your headache, go to the show notes and follow the link to Headache Australia, where there's just lots and lots of information. So I think it's worth looking at some of the nutritional things that are so easy to overlook. I already mentioned water. So if you're dehydrated, then that actually affects your blood flow. So, and your brain can't operate without blood flow. So staying really well hydrated is number one. Everybody seems to carry a water bottle around these days, just simply as a reminder. It doesn't have to be a fancy, expensive one. It can just be a refilled bottle that you've got, lurking in the cupboard, and drink lots and lots of water. How do you know how much water is enough? Well, you can probably guess that.
You're reading my mind today, Claire. I'm going to ask you these questions and you're just saying it anyway.
Rattling on.
No, not at all. But what is a good amount of water to drink a day? They say 8 glasses. What's 8 glasses though?
Yeah, it can be 8 glasses, but really, if you think about the weather in Australia from, the tip of Cape York down to the bottom of Tasmania, our weather is so variable, it's pretty hard to just say everybody must drink 8 glasses of water. But the amount that's right for you is the amount when your urine is the colour of straw. And, if you go, oh, I wouldn't have an idea, well, take a look, because that is really your individual barometer for how much water to drink, and recognising that for some older people, particularly if they have kidney disease, for example, they may have some limitations on the amount of fluid they're told to drink. So, that which potentially could be contributing to headache as well.
So are you saying if you live in a hotter area where you might sweat more, then you're losing more water, so you need to drink more water?
Yeah. In a nutshell, that's
Fabulous.
it. In winter,
Right.
you need slightly less than you do in summer. Yeah.
Okay.
But one of the other things, before we even go on to look at some of the other factors contributing, I mean, if this is ringing a bell for people and they go, actually, yeah, I do get quite a bit of headaches and maybe I don't drink enough water. Another thing that you need to know about is whether or not how often you get headaches. And again, we'll put a specific link to this page on Headache Australia because they've got a downloadable headache diary. And if you go, maybe my headache patterns have changed, well, then you can download the diary and start putting in details about your headache.
That would be a really good resource to track when they come on, and if they come on at a certain time, like especially if you're a woman,
Yeah.
it might be related to
certain times of the month, or if
Exactly.
they've changed, but now it's relating to menopause, which, again, might be changing things. But this is the best way to get the best information about your headaches and whether there's any change in your usual pattern, and then it gives you a firm basis to go and talk to your doctor. Chances are you go and talk to your doctor and they'll say, well, how often do you get a headache? And if you go, oh, I'm not really sure. If you've got the information, you'll get to the heart of the matter sooner. So, Ilyse, um, can you have a guess as to anything else that you think might relate to getting a headache at all? Anything else?
Um,
Not migraine specifically, but headaches generally.
well, I guess like there'd be a whole heap of factors, like what you eat, whether you're getting enough sleep, whether you're
Yeah,
drinking coffee, and whether you're having withdrawals, that type of thing.
yeah, all of that,
Yeah.
because there's one trigger for headaches broadly, and it's also a trigger for some people for migraine is caffeine, and there's two aspects to that. So interestingly, when you get a headache, if you take, pain medication, if you combine it with a drink that's got caffeine in it, tea or coffee, it actually potentiates the effectiveness of the medication. So in other words, it makes the drug work better. So it makes your Panadol or your Nurofen work slightly better for the pain relieving effect. So I
Right.
find that really interesting.
So have it with a cup of tea or a cup of
Yeah,
coffee.
have it with a cup of tea. And when you think about it, I think that's probably naturally what some people do. They go, oh, I've got a headache. I'm going to put the kettle on and have a Panadol. It actually works. It's helpful for people. So there's that aspect. There's a really unusual type of headache called a hypnic headache that's more common in older people, and it's associated with sleep onset. So you're heading off to bed, trying to fall asleep, and then you get a headache. If it's a hypnic headache, one of the recommendations for treating that is actually caffeine, which when I read about that, I thought that's counterintuitive. And then I thought, wow, I think my father-in-law must have experienced hypnic headaches and developed his own remedy, because I remember he always went to bed with a cup of cold coffee to drink during the night. And I remember thinking, that is so unusual, but he likes doing that and that works for him. And I wondered if that was like he'd worked out his own remedy for,
Yeah.
for better sleep for him. But it is kind of counterintuitive, isn't it?
Yeah. But then my father-in-law drinks coffee all day as well, like it's water. So it obviously doesn't affect him in that sleep capacity either. So
Yeah,
I guess
yeah.
just everyone's different, aren't they?
Everyone's different, but to that point, high amounts of caffeine is normally a stimulant, and it can keep you awake. But you metabolize it more if you have a regular higher dose. And then the other point on caffeine is that if you have any liver disease or like a small liver, like kids, then it has a much stronger effect because it takes longer to metabolize. So liver disease or smaller livers, so in children, so like 7 to 8 hours, and that's why you normally hear that advice
Right.
about not having a lot of caffeine in the afternoon, particularly if you're having sleep problems. But when you think about it, if you're used to a certain amount of caffeine from coffee, tea, whatever other sources, then your body is used to getting it, and it's going to demand it, if you like.
Yeah.
So if you don't have any caffeine, you're for 12 hours, say, then you can actually get a caffeine withdrawal. And the key feature of caffeine withdrawal is actually a headache. So if you're the sort of person you wake up in the morning and go, oh, I feel a bit of headache, go straight with a cup of tea or coffee, then it's potentially you have an overnight caffeine withdrawal. And the other interesting thing about headaches is that they can increase when you're fasting. So if you have dinner really early, like you had dinner at 6 o'clock, and now, you slept in and now it's the morning, you go, oh, got a little bit of a headache. You could have a fasting induced headache. I think people who get headaches in response to fasting are more likely to notice it when they've got to go for a blood test and they've needed to fast, or they're having some sort of test or surgical procedure, colonoscopy, for example, where there really is like a longer fasting period and people feel really headachy in those events. That can either be the because you haven't eaten much, your blood sugars are on the lower end, or it can also be caffeine withdrawal, or it can actually be both.
Yeah, right. Are there
So just
certain...
go on.
Oh, no, I was just going to move on and see if there's certain foods that trigger
Yeah,
migraines.
well, but just before we talk to that, I just want to mention that, if you get a morning headache that's pretty new, you don't think it's associated with caffeine or the overnight fast, and it's associated with nausea, that can be a sign of a headache that requires medical attention. And there are a number of types of headaches where you really shouldn't delay and go and see your doctor straight away. So some of those are like a thunderclap headache, like, yeah, wow, is there someone standing behind me? I feel like I've been like whacked in the head. If you have it's affecting your speech, like you need to make sure that that's not a stroke. And if there's anything that gives you that like sense of urgency, like this could be a medical emergency, then make sure you call 000. If there are worrying symptoms where your severity and frequency are increasing, then go and see your doctor, because you may need medical treatment, and you
Yeah.
definitely need medical review.
Yeah, good
Okay,
advice.
now,
Yeah.
what were you going to say?
So I want to know, are there certain foods that might trigger headaches and migraines? I do remember I had a friend that, so bad for her, that couldn't eat chocolate because it would bring something on for her.
Oh, right. Yeah, well, that's super, super interesting. And one of the interesting things about migraine now, the triggers where there's a food, that tends to be more common in migraine.
Yeah.
And what's super interesting about migraine is that some of the research is unsure whether that's a trigger, those foods are a trigger, but for some people they definitely are, or whether it's associated with like cravings that are signaling the onset of a migraine. So with migraine, there's actually 4 different stages of a migraine. I don't want to say them wrong, so I'm just actually checking what Headache Australia, how they name them. So they call it the prodromal phase. And the prodromal phase, that's like a change in mood, behavior, or dietary cravings, and that can be in the hours or days before you get the onset of a migraine.
So at this
And
point, you might not even feel any tension in your head, but these symptoms are occurring.
yeah, just really subtle changes. And what they're saying is that for people who get migraines, they call them migraineurs. So people who get migraines, they're actually not as good as you might think at recognizing this prodromal phase, the pre-headache onset phase. But they say that's where a lot of food cravings are most associated. So things like, chocolate, or, things like, there was one that did the internet rounds lately, Coke and fries, and they associated that more with this prodromal phase, where your body goes, something's not right, something's changing, and it's trying to reset blood sugars. It might be trying to reset electrolytes. It's trying to help you feel comforted and secure, like ahead of this pending migraine that's going to onset. Whereas for some people, they really do feel like, oranges, for example, actually trigger an actual migraine event. So the research is a little bit uncertain in terms of trigger foods. So then the second phase of the migraine is the aura. So that might be something about the vision and the senses that's being affected, or actual neurological function. People feel like they cannot think straight. Then there's the throbbing headache phase. And I didn't realize that can last anywhere from 4 to 70 plus hours. Imagine. I feel sorry for everyone who gets migraines regularly.
I was about to say the same. I'm glad I'm not what did you call them? A migraineur.
Migraineur. Well,
Yeah.
my dad was a migraineur, and my sister. My sister used to get migraines associated with menstruation.
Yeah.
My dad, do you remember the old cameras, and you had those like plug-on flashes, and then you turned it to take the next? You took his photo with a flash camera.
Oh, that would
he would
trigger
get a migraine. He was super, super light sensitive. Yeah, so so I know how disruptive that is for people who just, there's nothing they can do except go to bed and get the medication. But then the post-drone phase, that's as the migraine headache is sort of going down. But you can imagine someone who's been on this roller coaster of a migraine, it's not surprising that the aspects of that is feeling washed out, fatigued, and trouble concentrating still. So I think if you've got a migraineur in your family, all you can do is try and make them comfortable. If it's a migraine that goes for days, bring them in the cups of tea or their migraine medication, whatever they need, into that darkened room, or however they've worked to get through it. One of the other things about migraine in terms of lifestyle triggers, one of them was stress.
Yeah.
So,
that's not surprising.
Not surprising. So, working out how to manage stress, and that may be another aspect where you need to talk to your GP. There are some good online programs these days. There's a website called This Way Up that has really good programs. But if it's a medically prescribed program, like for stress management, then some of those This Way Up programs, there's actually no charge. So managing stress. So, for everyone, lots of people have stressful lives. This is an ongoing event. So now I just want to talk to, though, in the both headache and migraine triggers. This is probably not going to surprise listeners, and you probably go, oh, can you people do one podcast episode without talking about healthy dietary patterns? But
no, that's what we're here for. Nutrition Science Bites.
Yeah, but for both headache and migraine, having healthier dietary patterns does seem to be associated with lower risk for getting headaches and for getting migraines. So, so the dietary patterns, when they've done these studies, vegetables, fruit, whole grains, nuts, seeds, and lower intakes of ultra-processed foods. So lower intakes particularly of sugar-sweetened beverages and highly processed food. Like, no surprise there. The one thing that did kind of stand out for me when they're talking about these healthy dietary patterns, though, was there was an emphasis on having better quality or healthier types of fatty acids. So probably everybody's heard about omega-3. It's an polyunsaturated fat that has a very long chain and has specific aspects when it's metabolized that it helps your body produce more anti-inflammatory chemicals in your body. So that probably then makes sense for why, if there's like overall stress or you're having dietary patterns where they're triggering more inflammation in your body, having the types of fatty acids that your body can go, well, I can turn that into an anti-inflammatory chemical and go down and help your body neutralize this inflammatory process. So omega-3 fatty acids, everybody immediately thinks of supplements, but they are found in fatty fish, salmon, sardines, mackerel. Have a look in the canned fish section, because that's some of the cheapest fish, and a lot of those fatty fishes are actually in cans. But then other healthy fatty acids are things like soybean and canola oil. So if you're using oil at home.
Is it avocado one?
Yes, avocado has monounsaturated fats, but things like avocado and olive oil, the monounsaturated fats, they're also a little bit neutral in the inflammation production process. So the omega-3 fats, also in chia seeds, flax seeds, and walnuts, they actually help drive towards the anti-inflammatory chemical production.
Are they the tennis ball boys that you were talking about with Dr. Catherine Brain?
So in the inflammation process, there is one extra step that happens. Inflammation drives the production of free radicals. And free radicals are those crazy tennis balls being fired at you from the machine. And the anti-inflammatory chemicals are like the giant catcher's mitt or the airbag in the car that can go, oh, you terrible, free radicals that are going to harm this person's body and their cells. I'm going to take you out of action. There are lots and lots of nutrients that can have this role in neutralizing the free radicals, but the long chain fats have an extra role in actually producing like anti-inflammatory chemicals in your body. So the healthy fats, particularly the long chain fats, do that. The monounsaturated fats are a little bit neutral. they can allow your body to let the omega-3s get converted into anti-inflammatory chemicals. But there's one type of fat that actually drives inflammatory chemicals. Can you guess what that is? What's the like nasty type of fat we always talk about? I bet you can.
Saturated.
Yeah, the
Yeah.
saturated
Yeah.
fat. So that's why, things like fast food, junk
Yeah.
food,
Okay. Yeah.
white fat on meat, they're not helpful. They're actually driving the inflammation process.
Yeah.
Okay, so we've talked about that as part of that. But I think, have you got anything else on your list before I keep
I
going on
do
and
have a
on?
couple of questions. Well, elimination diets for migraine sufferers.
There's not there's not really a lot of research
Yeah.
evidence on that,
Yeah.
but I can understand the motivation behind somebody wanting to go to an elimination diet.
Yeah.
So an elimination diet is normally used to try and work out food allergies or food intolerances particularly. So in a food intolerance, that's kind of like, it's not an immune reaction, like a bee sting immune reaction.
Yeah.
But it's an intolerance is that you can actually eat a certain food up to a certain amount, and then once the dam wall goes over the edge, over the limit, you get a whole range of reactions. Headache may be one of those, but it's likely other types of allergic reactions as well, like rashes
Yeah.
or other types of reaction, respiratory effects or things like that. So we might do a whole separate podcast on food intolerance versus food allergy down the track. But elimination diet, I think the motivation for people is they're trying to find their triggers.
Yeah.
So I think if you're going, I really want to know my triggers, keeping the headache diary
Yeah.
is probably going to be your best way to try and work out the triggers. And remember, like, especially for migraine sufferers, where that early phase, that prodromal phase, where people are maybe seeking some foods that help them feel better, that may help with recognizing those in that early phase.
Yeah. Okay, so then what about, is there any evidence for a ketogenic diet or a low-carb diet for managing migraines?
Yes and no.
Right.
Never a straightforward answer,
No,
is there?
never.
So that's interesting. And we actually did a research study on ketogenic diet many years ago. So I went to have a look, in fact, to see if anybody else has done ketogenic diets. And I did find a systematic review that's pulled up all the small studies, like our study was pretty small. But first of all, let's talk about a ketogenic diet and why is the interest in those. So a ketogenic diet is where you do lower the carbohydrate and you really increase the fat. And there's different categories of ketogenic diets, and I'll put a link to a big organization in the US called the Charlie Foundation,
Okay.
where they medically supervise and manage these diets. And that foundation was set up in memory of this very wealthy person's son who had, I'm pretty sure he had epilepsy. Okay, so the rationale for these is that you can, is to try and affect the electrical activity of the brain so that it doesn't fire off in abnormal patterns that cause epilepsy. And part of that came from the recognition that, well, the brain can actually metabolize ketone bodies that are produced when you metabolize fat. And it can really, and that has this secondary kick-on effect of influencing electrical activity. So when I was a pediatric dietitian, we would sometimes help families in a highly supervised, monitored trial of a classical ketogenic diet where the ratio of fat to protein and carbohydrate was like 4-1. So you eat hardly any foods with carbohydrate in. This was the point, at least, where these little kids, they were wearing helmets because of the huge number of epileptic fits they were having per day, such that they could harm themselves from when they fell from having an epileptic fit. So it was to protect them. And it was to the point where the kids, they couldn't even really drink much milk. They would drink a mixture of like cream, small, tiny amounts of milk in order to still be getting some calcium. But you would even have to count things like let's say they're allowed to have strawberries. Well, maybe there was some strawberries you could have over the day, but you were not allowed to leave your child alone, like with a punnet of berries. And you know what little kids are like when they like something, they really like it.
Yeah.
So extreme hard work. And there is some evidence that these ketogenic diets can actually improve this type of epilepsy that does not respond to medication. So that's where the interest got. Well, what about then for people with migraines that aren't controlled? And the systematic review says it looks like there is some benefit from the different types of ketogenic diets, not just the 4-to-1, but the ones that are less restrictive in helping with migraine frequency and or severity across the different studies. But it's extremely hard to follow, and there are a lot of side effects. So my take from that is that if you need a medically supervised trial of a lower carbohydrate towards a ketogenic diet, that needs to be medically supervised. And the reason I'm saying that is because there's another study on the use of ketogenic diets in older adults where there is an increased risk of death and incidence of heart failure. So this is about weighing the benefit versus the
Yeah,
harm.
you don't want to get that wrong.
No, you do not. No, you do not.
No.
But what you can safely apply at home is a reduction in the junk food carbohydrates. So that's things from sugar-sweetened soft drinks,
Biscuits, chips.
Yep, cakes, all of those kinds of things, and boost your high quality grains. So, rolled oats for breakfast rather than a sugar-sweetened cereal. Whole grain toast rather than, white bread. Drink water or, moderate your tea and coffee intake rather than drinking lots of sugar-sweetened soft drinks. Using a whole grain pizza base rather than using a white pizza base. So, it looks like there's something around reducing carbohydrates, especially reducing junk food carbohydrates. But once you're on that, I would encourage people again to go and see their GP, get their headaches and their migraines particularly managed, and then ask for a referral to a dietitian.
Yeah. Okay. Very interesting stuff.
Yeah, super, super interesting. There's one more that I think is worth mentioning, and that's alcohol. So there have been studies on migraineurs. This one's for you, particularly everybody who gets migraines frequency, that alcohol can trigger migraines. And when they've done studies, they've actually shown that people with migraines drink less alcohol. And they think it's for that reason that, either consciously or subconsciously, people see that it triggers their migraines. So, safe drinking it within the safe amounts is really wise. And everybody knows what happens if you binge drink. There is another very specific type of headache that you get.
Yeah. Self-inflicted. So
sorry, there's no sympathy. No sympathy. And we've, our podcast on alcohol is one of the most one of our most listened to podcasts. So you can go and listen to that.
Yeah.
Yeah. So I think the bottom line, Ilyse, is, the healthy dietary patterns are like in the prevention. We're really recognizing that people with migraine, there may be triggers. They may be associated with that prodromal phase. So the headache diary is going to be really, really helpful. If that shows there are trigger things, obviously avoiding those.
Yeah.
But for everyone, try and reduce your headaches. The healthy dietary patterns, we specifically gave a shout out to the healthy dietary fats and to lowering the junk food carbs, boosting your water intake, and then recognizing, the role of caffeine. It may be helpful, but for some people it may not be.
Excellent tips. Thanks for that, Claire. Appreciate it.
Yeah, great to chat.
And thank you again for our listener who sent that question in. We love receiving those extra questions so we can do deeper dives into topics of interest.
Yes, absolutely. Thanks for the great question.
Okay.
Bye.
Thanks, bye.